This literature review examines and synthesizes articles exploring the risk factors, treatments with depression, how it affects many lives, and what it's done with this issue. Um, there are many different kinds of treatments to help with people who have depressive episodes, but there are three common methods used in a depression treatment, which include cognitive behavioral therapy, interpersonal therapy, and psychodynamic therapy. There are other ones in my final literature review that you can read, and it gets more information about all of those. There are 3.8% of the population that is affected by depression, including people from older people who are older than 60. There's approximately 280 million people in the world that have depression. It's a big number. In the United States, there's at least 21 million adults that have at least one major depressive episode. Why I chose this topic. Many people from the ages of 13 and older are affected by this disorder. They lose their jobs, lack of motivation, loss of weight, aren't physically helpful, and they have financial issues. People with a depressive disorder may have problems, whether it's medical, financially, physical, emotionally. While working at a health center, I've come to realization that many people or patients that need help are diagnosed with a depressive episode. And with depression, there's anxiety, panic, yada yada. Continuing on, I wanted to look further into this research and suggestions of other people and what their opinions are on this matter. I started to notice while working that the negative symptoms and self-care these patients are getting. People with a depression is a significant social issue. It can happen to anyone at any point in time, whether they're young or old, and it happens once in every people's lifetimes. Some can last 2 to 3 weeks, some can last a year. But overall, I just wanted people to know that having depression is okay because everyone in the world gets it. Alrighty. People will lose their jobs and will have a financial problem which lead to poverty and homelessness, which this becomes a social issue. It's chronic, unsafe, and dangerous. Homes such as abusive families or violent relationships that undermine self-confidence, and social failures such as friendship breaking or just moving away or cutting contact with people. An example of this is nursing and childcare workers. They are the top on the list. Nearly 11% people have a major depression. It can become very stressful seeing that people are sick and aren't getting any positive reinforcements from anybody. That's an example from nursing. And an example for social workers is that it's probably not as huge, and not a huge surprise. Dealing with abusive children or families on the brink of even unimaginable crisis, because social workers work with people who are in need or needy. It can be hard sacrificing so much for this job. It happens to social workers and many other professions, and they get burnt out pretty easily. And being burnt out is kind of like one of the symptoms or effects of fatigue, and that's not good, which leads to depression. Okay, ton of people are affected by this issue due to a lack of evidence within some programs. Many of these people are suffering. Like for instance, control groups, which are topics like sports and beauty, are positive and self-caring topics that help boost up confidence. Social workers advocate diagnosing and treating mental health conditions, provide therapy, and assist with mental health or behavioral issues. They respond to crises evaluate social services and support programs, admission and supervision, and support systems. With supervision, they basically make sure they go to the doctor patient, they go to their medication or a doctor's appointment. They're basically doing what they're supposed to do to get better to themselves. Okay, so there are risk factors for depression. Most likely, the main ones are mental health and medical health. With mental health, there are different kinds of depression. There could be chronic, clinical, mild, mania, aka there's bipolar disorder. Most with it is anxiety, and that comes with the whole mental health problems. Over here in the square, I have anxiety disorders, panic disorders, general anxiety, and social phobias. Suicidal ideation is most likely with clinical and chronic depression, though don't get me wrong, it could be with any of them, but that's most likely what I'm seeing. There are other two conditions like OCD and PTSD that go along with it. The second most important one is medical health. There are a variety of medical conditions that go with depression. With cancer patients, clinical depression is most likely that's going to affect them. You can get chronic pain, thyroid problems. 33% of people who have heart attacks end up with depression. You can get kidney disease and digestive problems, which leads to a whole ordeal. You get HIV and lupus. Fatigue is one of the most common symptoms you'll find in depression, or the doctors will most likely ask you. But the most important thing is depression affects the brain chemical balance. It's the neurons in the hippocampus that shrink, and that will lead to memory loss and difficulty concentrating on things. And it's very upsetting because this basically is one of the main reasons why you have a lack of motivation and you don't want to do anything. Depression is one of the most common conditions in primary care, but often is unrecognized, undiagnosed, and untreated. With primary care physicians assess depressed patients that have any suicidal ideation. There are different diagnoses for depressive episodes like mania, clinical, postpartum, severe, bipolar disease, seasonal affective disorder, or psychotic depression. There are approximately 280 million people in the world that have a depression episode. And there are different kinds of treatments that can help improve their current level of functioning. Depression is a reoccurring symptoms and cannot just disappear like a cold. It always comes back. Whether it's severe, mild, tiny, it comes back. Kind of like the flu. Many people with any depression are prescribed by a doctor or a physician to take an antidepressant to help them with their disorders so that they can live in a community without having any problems. Having a low self-esteem only feeds to depression and make it either clinical or chronic depression. Self-confidence is a very important thing. Without self-confidence, it's basically making a depressive episode either chronic or postpartum. With having no self-confidence in yourself, it's basically not getting out of bed, not hungry, starving yourself, which basically leads into depression, and that's really not healthy for you. Which affects people with self-confidence in themselves and feel like they're alone and no one understands them or they don't care. It is best to see a doctor or a therapist to help improve their symptoms so that they can live in a community and they can go do stuff without wanting to just stay in bed or be alone. And that is all for my essay. I hope you like it.